Ultrasound plays a critical role in reducing maternal and neonatal mortality. Nearly 300,000 women die during pregnancy and childbirth every year. About 40% of pregnancies have some sort of complication. In 15% of all pregnancies, the problem can be life-threatening. With ultrasound training, healthcare providers can identify many of these conditions early in pregnancy and refer high-risk pregnancies to a hospital for safer delivery. The information you gain from ultrasound, in addition to what you learn from the history and physical exam, will help you and the mother determine where it is safest for her to deliver her baby. In this course, you will learn how to operate ultrasound equipment accurately, safely, and efficiently as a part of routine pregnancy care. Ultrasound will not take the place of your current antenatal care practice, but it will become a natural part of it. Here is an example of how ultrasound can help you determine the proper course for delivery. A 20-year-old woman who has had no problems in her pregnancy plans to deliver her first baby at your health center. She visits you for a routine antenatal visit at 32 weeks. You detect a condition called placenta previa by ultrasound. Right now, this image will not make much sense to you, but in just a few days, you will glance at this image and know exactly what it shows. This image shows a placenta previa, which is a condition in which the placenta covers the cervix. Here is the cervix, the placenta, amniotic fluid, which is black and surrounds the placenta, and the bladder, which is also black because it contains fluid. The placenta completely covers the internal opening of the cervix, called the os. This is called a placenta previa. If this patient attempts a normal vaginal delivery, she is very likely to hemorrhage and die during the birth. From this training, you will learn that all mothers with placenta previa that is still seen by ultrasound at 32 weeks need to deliver at a hospital. Because of ultrasound, this patient had a cesarean section at the hospital at 38 weeks and is still alive. In the next 2 weeks, we will cover how ultrasound works, how to use the ultrasound equipment, how to see the anatomy of the fetus in the first, second, and third trimesters, how to determine pregnancy dating by ultrasound, and how to determine the normal and abnormal appearance of the placenta, cervix, and amniotic fluid. Other topics that will be reviewed include how to determine fetal position and fetal number, and how to identify complications in the pregnancy, like a breech baby, placenta previa, ectopic pregnancy, and a miscarriage. There is a particularly important ethical standard in this course and in ultrasound practice. When doing ultrasound, never reveal the baby's gender, even if the mother or other family members insist. Our practice is to tell the patient and the family before scanning that the gender will not be revealed. We will discuss this issue throughout the course. Please refer frequently to the participant handbook and review its content, which can be obtained on our website. The handbook includes a daily schedule, copies of PowerPoint slides, review questions for lectures, hands-on session and notes pages, a scanning checklist, and fetal measurement charts. Each day of our training, there will be a different theme. For example, Day 4 will show different types of fluid and the placenta. On Day 5, we will discuss multiple pregnancy and fetal position. This training involves both lecture and hands-on practice. We will start with lectures in the morning, followed by hands-on scanning in the late morning and afternoon. The hands-on sessions are in gray boxes on your schedules. We'll also break for tea and lunch. Lecture time will include much more than PowerPoint slides. There will also be demonstrations, group discussions, case studies, and other exercises. You will stay very active in this course. In this course, we will emphasize the hands-on sessions where you will learn by scanning with a partner while being supervised by instructors. Each hands-on session will have a specific goal and detailed instructions. You will begin by scanning each other, and then you will scan patients in clinic. The key to becoming successful at scanning is practice. The more you scan, the more you will learn. Take every opportunity you have to practice scanning. We recognize that you are already trained and skilled in caring for obstetric patients, so share your experience with each other. You will become even more effective in your work with ultrasound. Give yourself time. Ultrasound is different from your prior training, so it may feel difficult at first. Don't allow yourself to get frustrated. With a little effort, you will quickly learn the skills that are necessary to be successful in ultrasound. The key to success is to practice. Scan as often as you can. Here are some other tips for success in this course. Please be on time for all sessions. Ask questions anytime you are unsure about something in lecture or during the hands-on sessions. Be willing to make mistakes. This is part of the learning process. Work collaboratively with each other. There are no formal exams in this course. However, there is a list of skills you must perform successfully during OB ultrasound. Instructors will watch you scan and demonstrate those skills. For a list of these skills, please check the Scanning Skills Competency Checklist in the Participant Handbook. We also want to hear your feedback about our teaching approach. You will complete feedback forms throughout the course and a formal evaluation at the end of the training. This is your opportunity to help us improve this course for you and future classes. We will also conduct a pre- and post-training assessment to evaluate how much you have learned as a group and how well we are teaching the course. Today we will determine how much you already know about OB ultrasound with a quick written assessment. We will repeat this assessment at the end of the course and compare the group scores. Thank you for your attention and interest in learning pregnancy ultrasound.